Hi there. The focus here is on the types and causes of insomnia, as well as what a healthy sleep cycle actually looks like. As you may be aware, there are many different types of insomnia. A few of the common ones include sleep apnea, medical condition-related insomnia, and sleep hygiene insomnia. This is where the sleep environment is not supportive for a good night's rest. Although there are many specific types, the two main categories of insomnia are acute and chronic. And acute insomnia is defined as lasting relatively short period of time, usually just a few days, but it could be up to a couple months. And chronic insomnia lasts a longer period of time, at least a few months, and occurs about 3 nights a week or more for a month or longer, even when there's plenty of opportunities to actually sleep. The other distinction we make with insomnia is whether it's primary or secondary. And primary simply means that sleep problems are not related to any other issue like a health or life circumstance. Secondary, on the other hand, means that sleep issues are happening as a side effect of another life challenge. This could be an illness, maybe pain, stress, or an unexpected life event. Whichever way insomnia is defined or described, it always relates to a lack of sleep, be it quality, quantity, or both. And it can manifest as having difficulty either falling asleep, staying asleep, waking in the early hours, or just really not feeling refreshed when you get up in the morning. As you know, all of these can have very real and very negative side effects on your life and well-being. There are many things that can cause either acute or chronic insomnia, and most of these things are pretty obvious culprits. They include things like stress, anxiety and depression, chronic pain, diet, especially if you use a lot of stimulants like caffeine, alcohol, or nicotine, also late night eating, of course, poor sleep habits, very common for many of us. This could be having screens or watching TV right before we go to bed, maybe napping during the day, or just having irregular sleeping and waking hours. Also, environmental factors like noise and light, traumatic offense or stressful life events. This could be a death of a loved one, a breakup in relationship, or a change of job or home. Or an interference with your normal daily routine. This is very common in things like jet lag or a change in a work shift. Chronic medical conditions, obviously, big cause, whole array of them: hypothyroidism, Parkinson's, pain, restless leg syndrome is a big one, and many others. And finally, obviously, medications, especially if you actually need to get up in the middle of the night to take a medication, but their effects as well can keep you up at night. So what do you think is causing your insomnia? It may be something that you haven't thought of before, maybe something from the list I just read. Or maybe it's something obvious that you just haven't been able to change or don't have control over. Most of the time, it's a combination of factors. And this is actually what can make insomnia a little bit tricky to treat. So let's talk briefly now about what a healthy sleep cycle actually looks like and what stages in the cycle insomnia can wreak havoc on so that you can understand what's happening when you don't get the sleep that you need. There's 4 main stages to the sleep cycle. The first is called sleep onset, and this is obviously when you're drifting into sleep, and research shows that the average person, without insomnia of course, takes just about 7 minutes to fall asleep. The second stage is then called light sleep. This is when you're actually fall asleep, but it's still kind of a delicate time where it's easier to be awakened. And the third and fourth stages are called deep sleep and REM. These take up really the bulk of your entire sleep cycle, and REM sleep is typically where we dream most. The cycle of these 4 stages is usually about a 90-minute cycle in total. And when we're sleeping well, we have just about 5 or 6 repetitions per night. And when our cycles are interrupted due to insomnia, we often experience challenges in daily life. And you may know these well. These are things like poor memory, low energy, lowered productivity, a greater susceptibility to illness, This is because our immune system actually becomes depressed with a consistent lack of quality sleep. And also increased stress. This could manifest as flare-ups in medical conditions as well, things like arthritis. Okay, now you have a bit more knowledge about the types of insomnia, how it's classified, and what a healthy night's sleep really looks like. Next, we're going to walk you through some common treatments for both acute and chronic insomnia.